If you've been debriefing for a while, there's a good chance you're making at least one of these mistakes. Not because you're inexperienced, not because you don't care, but because the longer we debrief, the more comfortable our habits become. And some of these habits quietly limit what is probably some of the most effective learning. So let's get started. Hi, I'm Dr. Paul Phrampus. I'm the director of the Winter Institute for Simulation Education and Research at the University of Pittsburgh and the UPMC Health System. Most of you probably know us as Wiser. If you've been facilitating simulation debriefings for a while, you already know lots of the basics. Picking a model, like the gas model, and getting good at it. Structure matters. Creating reflection matters, and knowing that the learners learn best when they can reflect on what happened and articulate why, as we create those precious moments during debriefing that allow us to get in the mindset of the learner. But here's the uncomfortable truth. Even experienced faculty make predictable debriefing mistakes. Not because they're careless, but because these habits are subtle. They're comfortable. They often look and feel like good teaching. Today I want to share 3 debriefing mistakes I see even in facilitators that are very seasoned. And yes, even I make every one of these mistakes and still do if I'm not careful. Before we get started, if you're finding this or any of our Wiser channel videos helpful, please hit like and subscribe. We put out regular content on simulation, leadership, assessment, and technology, and subscribing helps you not miss the next one. All right. Let's dive deeper into it. Mistake number 1. Lecturing or mini lecturing instead of debriefing. This is the big one. The scenario ends, everyone sits down, and before you know it, the facilitator is giving a mini lecture. And look, teaching is not the enemy, but when we default to simply lecturing, we're short-circuiting some of the power that is created by good debriefing. Because the core job of the debrief isn't to display expertise. It's to make visible the learner's thinking. When we lecture, we tend to do 3 things. We correct, we explain, we wrap things up neatly, but what we don't do is get in the mind of the learner. But debriefing is supposed to do the opposite. Explore surface mental models. Understand decisions in context. A simple self-check I use is this. If I'm talking way more than the learners, I'm probably lecturing, not debriefing. Quick fix. When you feel the urge to explain, pause and ask a question that invites the reasoning out into the open. What were you seeing at that moment when such and such happened? What were you worried about? What did you think would happen next? Then listen. Longer than might be comfortable during normal conversation, because debriefing is actually leadership. It requires restraint. Mistake number 2. Debriefing performance instead of the thinking behind it. Mistake number 2 is about what we choose to focus on. Experienced facilitators are great at spotting performance gaps. You didn't call for help early enough. You missed that saturation drop. You didn't communicate the plan. All of that might be true. But if we stop there, we're essentially debriefing the visible behavior without understanding invisible drivers and behind the scenes that led to the decisions and behaviors that made up what became the performance. Because performance is visible, thinking is invisible. And debriefing is how we make the invisible thinking visible. So instead of staying anchored on the behavior, we need to get underneath of it. What cues were you prioritizing? What diagnosis were you leaning toward? What assumptions were you operating under? What competing task felt most urgent? When you do that, use some of those examples, something interesting happens. You often discover what looked like a mistake was actually reasonable. Reasonable decision based on an incomplete picture. Competing priorities, or a faulty assumption, maybe a misinterpretation of what you were trying to simulate. And that is where learning lives. So try this for a quick fix. Pivot towards a phrase. I noticed X. And I'm curious what your thinking was in that moment. That one sentence tends to keep you out of judgment, keeps learners engaged, and moves the conversation towards decision making. Mistake number 3, confusing psychological safety with comfort. Mistake number 3 is one that's become more common as we appropriately emphasize and re-emphasize psychological safety. Sometimes experienced facilitators tend to overcorrect. They avoid tension. They soften everything, and they hesitate to name or to bring out into the open performance gaps that were clearly identified during the scenario. Reluctance to give feedback or let learners discover what they need to improve on is important. It is important to remember that psychological safety does not mean no discomfort, no challenge, no direct feedback. Psychological safety means it's safe to learn and that you will not be judged for knowing something or not knowing something or for making a mistake. And learning often includes discomfort, especially when you're confronting a gap between intention and impact. It is also critically important to remember that debriefing should remain patient-centric, meaning if the debriefing doesn't correct underlying deficiencies, it might happen that mistakes actually transfer to real patient care. Here's the distinction I want you to remember. Comfort protects feelings. Psychological safety protects learning. A debrief can be both supportive and challenging. In fact, the best ones usually are. So quick fix. Be explicit with your intent. Remain patient-centric. You could say something like, I'm going to lean into this moment because it matters for patient care, and we're here to learn, not to judge. That framing helps learners interpret challenge as investment, not criticism. And it gives you permission to be honest, and of course you're still going to be respectful. So let's wrap this up. Those are the big 3 that I'm talking about today. Lecturing instead of debriefing. Focusing on performance instead of the thinking. Confusing psychological safety with comfort. If you take nothing else away, take this. Debriefing is not simply a post-game report. It's an intentional conversation designed to change future decisions that need to be changed and reinforce the things that don't need to be changed. Now, I want to hear from you. Which of these 3 do you see most often in others or see in yourself? Drop your answers in the comments below. We read them, and it helps shape what we cover next. And once again, if this was useful, please like the video and subscribe. It genuinely helps the channel and helps us reach more simulation professionals around the globe. Thanks for watching, and I'll see you in the next one. Until then, happy simulating.